Welcome to today's video about hidden symptoms of blood clots. What if I told you that right now, as you're watching this video, there could be a silent killer forming inside your body? Blood clots affect as many as 900,000 people each year in the United States, and an estimated 60,000 to 100,000 Americans die of venous thromboembolism annually. Today, we're exploring 9 hidden symptoms of blood clots that medical professionals see in emergency rooms. These are not obvious signs. These are subtle symptoms people dismiss as minor issues, only to find themselves in life-threatening situations hours later. According to the Centers for Disease Control and Prevention, sudden death is the first symptom in about 25% of people who have a pulmonary embolism. This means for 1 in 4 people, there's no warning, no second chance. By the end of this video, you'll have knowledge that could save your life or someone you love. So stay with me, because what you're about to learn could be the most important information you hear today. Now, let's begin exploring the hidden symptoms of blood clots, starting with number 1, swelling in one limb. Picture this. You wake up and notice your left leg feels different. Your shoe feels tighter, or your sock leaves deeper marks. You think you slept awkwardly, but this seemingly innocent swelling could be your body's cry for help. When a blood clot forms in deep leg veins, called deep vein thrombosis, or DVT, it blocks blood flow back to your heart, causing swelling. The incidence of venous thromboembolism is approximately 1 per 1,000 people annually, with DVT accounting for 2/3 of these events. Here's what makes this dangerous. That clot isn't staying put. Research shows pulmonary embolism, where clots travel to lungs, occurs in up to 1/3 of DVT cases and is the primary contributor to mortality. The swelling isn't just uncomfortable, it's a warning sign. This symptom is deceptive because it develops gradually over hours or days. Your brain adapts, making it easy to dismiss. But medical professionals emphasize, if you notice swelling in just one limb, especially with pain or discomfort, don't wait to see if it improves. Studies show up to 30% of people with DVT don't have symptoms, but when swelling occurs, it's often the first reliable warning sign demanding immediate medical evaluation. Next, symptom 2, unexplained leg pain. Imagine sitting at your desk when you suddenly feel sharp, cramping pain in your calf. You haven't exercised or injured yourself, yet the pain persists and worsens. Medical research shows leg pain, often described as cramping or Charlie horse sensation, is a common DVT symptom. This pain has distinct characteristics. It's a deep, aching sensation from inside the leg, not the surface. Unlike pulled muscles that improve with rest, clot-related pain typically worsens with movement. The pain occurs because clots trigger inflammatory responses in surrounding tissues. Your nervous system alerts you something is wrong. Clot pain typically occurs in the calf, thigh, or behind the knee, areas where deep veins are most susceptible. Many people dismiss this as aging, poor posture, or minor strains. Medical studies show many people with blood clots notice persistent leg discomfort they can't attribute to recent injury or overuse. But when unexplained leg pain persists for hours, especially combined with other symptoms, it demands immediate medical attention. Next, symptom 3, warmth and redness. Your skin is one of your body's most sophisticated early warning systems. When blood clots form, they trigger inflammatory responses visible on your skin's surface. Medical studies show localized warmth and discoloration are common DVT signs. When clots block veins, surrounding tissues become inflamed, causing increased blood flow and skin that feels noticeably warmer than the opposite limb. Color changes are equally telling. Affected areas might appear red, blue, or purple because blocked veins cause blood to pool in surrounding capillaries. Think of it like a traffic jam. When the main highway is blocked, side streets become congested. This symptom is deceptive because warmth and discoloration develop gradually, making them easy to overlook. People think they bumped into something or have minor skin irritation. Superficial thrombophlebitis symptoms include warmth, tenderness, pain, redness, and swelling. You might see a red, hard cord under your skin that's tender to touch. If you notice warmth, redness, and tenderness in a specific leg area, especially with swelling or pain, your body is sending a clear message. Next, symptom 4, sudden shortness of breath. Imagine walking upstairs you've climbed hundreds of times, but suddenly you can't catch your breath. Your heart races. You feel dizzy, maybe faint. This isn't being out of shape. This could be pulmonary embolism, a medical emergency. When blood clots travel to lungs, they create pulmonary embolism. Research shows sudden shortness of breath is the most common symptom. The clot blocks lung blood vessels, preventing that lung area from exchanging oxygen and carbon dioxide. Your body responds by making you breathe faster and harder. Pulmonary embolism affects about 900,000 Americans yearly. According to the CDC, sudden death is the first symptom in about 25% of people with pulmonary embolism. This symptom is terrifying because it progresses quickly. One moment you feel slightly winded, within minutes you could be in respiratory distress. Unlike exercise breathlessness, this feels urgent and doesn't improve with rest. Time is critical with pulmonary embolism. Next, symptom 5, chest pain. That worsens with breathing. You're sitting quietly when you feel sharp, stabbing chest pain. It worsens when you breathe deeply, cough, or move. Your first thought might be heart attack, but this could be equally dangerous. Lung blood clots. Medical research shows chest pain worsening with breathing occurs in significant percentages of pulmonary embolism cases. When clots block lung blood flow, tissue becomes inflamed. Pain occurs because the pleura, thin lung membrane, becomes inflamed. Deep breathing stretches inflamed tissue, causing sharp, stabbing pain. This symptom is often misdiagnosed. Chest pain from pulmonary embolism is frequently mistaken for heart disease, pneumonia, or muscle strain. This misdiagnosis is dangerous because treatments differ completely. The key characteristic medical professionals seek is pain's relationship to breathing. Heart attack pain doesn't change with breathing patterns. Muscle pain improves with rest. But clot-related chest pain distinctively worsens with deep inspiration, a critical diagnostic clue. Next, symptom 6, rapid heartbeat. Your heart constantly adjusts function based on your body's needs. When you exercise, it beats faster. When stressed, it responds to hormonal signals. But when your heart races without reason, this could be your cardiovascular system compensating for blood clots. When clots block blood vessels, your heart works harder pushing blood past obstructions. Medical research shows rapid heartbeat is common when blood clots affect pulmonary circulation. Your heart tries maintaining adequate blood flow despite mechanical blockage. Most people don't monitor resting heart rate. You might notice pounding or racing, attributing it to stress, caffeine, or anxiety. Heart rate increases from blood clots often include palpitations, abnormal heartbeat awareness. When clots block pulmonary circulation, pulmonary artery pressure increases dramatically. Your heart's right ventricle faces massive resistance, causing your cardiovascular system to shift into overdrive. People experiencing rapid heartbeat might sit down, relax, or assume it'll pass. But when caused by blood clots, rapid heartbeat signals severe cardiovascular stress, requiring immediate medical attention. Next, symptom 7, persistent cough. With blood, coughing up blood often gets minimized when it first appears. People convince themselves it's minor irritation from dry air or respiratory infections. But blood in sputum, especially with other symptoms, could signal lung blood clots. Medical research indicates coughing up blood, hemoptysis, can occur with pulmonary embolism. While seemingly uncommon, it's highly significant because it indicates clots caused enough lung tissue damage to result in bleeding. When the symptom appears, blood clots have blocked pulmonary arteries, cutting blood supply to lung tissue sections. This tissue begins dying, pulmonary infarction. As tissue breaks down, small blood vessels rupture, causing blood to mix with airway mucus. Blood might appear as bright red streaks, pink-tinged foam, or rust-colored sputum. Even small blood amounts in sputum shouldn't be ignored, especially with shortness of breath or chest pain. Coughing might start dry and irritating, gradually becoming productive. Blood appearance indicates significant tissue damage occurred, meaning situations moved beyond early intervention into emergency territory. Next, symptom 8, severe headache or vision problems. Blood clots affecting your brain are particularly dangerous. Imagine waking with the worst headache of your life, or suddenly noticing blurry, distorted vision. These could be cerebral venous thrombosis signs, blood clots in brain venous systems. Research shows cerebral venous thrombosis affects approximately 2 to 5 people per million annually. Symptoms develop because brain blood clots prevent proper blood drainage, causing increased intracranial pressure and tissue damage. Associated headaches have distinct characteristics, differentiating them from tension headaches or migraines. They're severe, persistent, unlike any previous headaches. Pain typically worsens over time and doesn't respond to over-the-counter medications. Vision problems occur because increased brain pressure affects optic nerves and visual processing centers. Medical studies show ocular symptoms are among the most frequent presentations, occurring in approximately 77% of cerebral venous thrombosis patients, following headache occurring in 83% of cases. These symptoms are dangerous because they resemble other neurological conditions. People assume migraines, sinus headaches, or eye strain. But severe headache combined with vision changes, especially with nausea, confusion, or speaking difficulty, represents neurological emergencies requiring immediate medical intervention. Next, symptom 9, abdominal pain and vomiting. Our final symptom involves areas where blood clots are particularly deadly, yet difficult to diagnose. The abdominal cavity. Severe stomach pain different from any previous indigestion or stomach bug. Intense and persistent, possibly with nausea, vomiting, or bloody stool. Could be mesenteric ischemia. Blood clots blocking intestinal blood vessels. According to research published in the World Journal of Emergency Surgery, acute mesenteric ischemia has extremely high mortality rates, ranging between 60 to 80% if not promptly diagnosed and treated. Blood clots block arteries or veins supplying intestines, causing intestinal tissue to die from oxygen and nutrient deprivation. Abdominal pain from mesenteric ischemia has distinguishing characteristics described in emergency medicine literature. It's severe, constant pain that seems disproportionate to physical examination findings. Unlike appendicitis or gallbladder problems, the pain doesn't typically worsen with movement, but remains relentless and progressive. Vomiting occurs as your body responds to dying intestinal tissue and release toxins. Clinical research indicates that in studies of acute mesenteric ischemia, 95% of patients presented with abdominal pain, 44% with nausea, 35% with vomiting, 35% with diarrhea, and 16% with rectal bleeding. Approximately 1/3 of patients present with the triad of abdominal pain, fever, and blood-positive stools. This symptom constellation is terrifying because it progresses rapidly and is difficult to diagnose. Symptoms might be mistaken for food poisoning or gastroenteritis, but severe abdominal pain persisting and worsening over hours represents surgical emergencies demanding immediate medical attention. The 9 symptoms we've thoroughly discussed today represent your body's sophisticated emergency communication system. Each one is a desperate attempt by your cardiovascular, respiratory, or nervous system to alert you that something is critically wrong and requires immediate attention. These warning signs are not random or coincidental. They are your body's evolved survival mechanisms trying to protect you from a potentially fatal threat. Blood clots are truly an equal opportunity health threat that doesn't discriminate based on age, gender, fitness level, or overall health status. They can affect anyone at any stage of life, though certain factors significantly increase your risk. These risk factors include prolonged immobility, such as long flights or extended bed rest, recent surgery or trauma, pregnancy in the postpartum period, cancer and cancer treatments, certain medications, particularly hormonal contraceptives, inherited blood clotting disorders, and advancing age. The absolute key to survival when dealing with blood clots is rapid recognition of symptoms combined with immediate medical intervention. Every single minute counts when dealing with a blood clot, especially when it has traveled to critical organs like your lungs or brain, where it can cause irreversible damage or death within a very short time frame. What makes blood clots particularly dangerous is their ability to move through your bloodstream and lodge in vital organs without warning. A clot that starts in your leg can break free and travel to your lungs within minutes, causing a potentially fatal pulmonary embolism. Similarly, clots in brain vessels can cause strokes that result in permanent disability or death. If you experience any combination of the symptoms we've discussed today, particularly sudden onset shortness of breath, chest pain that characteristically worsens with breathing, severe headache combined with vision changes, or unexplained leg swelling and pain, please don't hesitate to seek emergency medical care immediately. Don't second-guess yourself. Don't wait to see if symptoms improve. And don't try to treat these symptoms at home. Trust your instincts about your own body. If something feels seriously wrong, if symptoms seem unusual or concerning, or if you have that gut feeling that something isn't right, it probably is serious and deserves immediate professional medical evaluation. Healthcare providers would much rather see someone who turned out to have a false alarm than miss someone who needed life-saving treatment. Remember, this information is designed to educate and inform you about these critical warning signs, but it should never replace professional medical advice, diagnosis, or treatment. If you're currently experiencing any of these symptoms, especially multiple symptoms occurring together, please seek immediate medical attention. Your life could literally depend on making that decision quickly and without delay. The research and medical information we've discussed throughout this video comes directly from peer-reviewed medical journals, respected medical institutions like the CDC, Mayo Clinic, and Johns Hopkins, and represents decades of clinical observation and scientific study by healthcare professionals around the world. This isn't internet speculation or fear-mongering. This is evidence-based medical knowledge that could genuinely save your life or the life of someone you care about. If this video helped you understand these critical warning signs and potentially life-threatening symptoms, please type helpful in the comments section below. Your feedback truly motivates us to continue creating educational content that could make the difference between life and death for viewers like you. Please consider liking this video to help other people find this potentially life-saving information. Share it with your family members and friends who should know about these warning signs. And subscribe to our channel for more evidence-based health and medical content. Thank you for taking the time to learn about these critical symptoms that could save lives. Stay informed, stay vigilant, and most importantly, stay alive and healthy.